Hello and welcome to today's show. I'm Jamie Smith, Cancer Control Specialist with the Kentucky Cancer Program. Today we're going to discuss head and neck cancer with local physician Dr. Darren Kess and hear a survivor story from Vernell Faulkner. Thank you for joining us today. First of all, Dr. Kess, I'd like to start with you. Just tell us a little bit about yourself, how long you've been in practice, and what exactly you do as a head and neck specialist.
Well, I work here with Purchase ENT. It's a local ear, nose, and throat practice. I've been in practice now for over 10 years, 7 of that here in Paducah. I did a fellowship training at Indiana University on head and neck cancer. And so I try to concentrate my practice with those type of patients.
Okay. All right. Well, we're certainly glad to have you here today and to learn a little bit more about head and neck cancers. Obviously, head and neck cancers is kind of a wide topic, so if you could just take a few minutes and kind of break that down for us and tell us exactly what that is.
Well, you're right. It is. There's a lot of topics that you can put under that category, and primarily, when we talk about head and neck cancer, most people are most familiar with throat-related cancer. So, throat-related cancer can occur in anywhere from the lips all the way to the voice box. So that's the area. Obviously, within the head and neck, we deal with everything that doesn't involve the brain.
Okay.
So the skin structures, the saliva gland structures, the endocrine structures, which consist of the thyroid, are all in our territory of treatment, as well as the lymph nodes.
That's a big, wide scope for you to have to look at that. How common are head and neck cancers?
We really don't get a lot of publicity, and maybe that's not such a bad thing, consisting it's not one of the more common malignancies that you hear about in the press, such as lung cancer, or colon cancer, or breast cancer, but it is a significant amount. It basically encompasses about 6% of all malignancies that the human being can develop. It's pretty big. 36,000 people in the United States are diagnosed with head and neck cancer a year.
Okay, well, that kind of puts it into perspective for us then. Do you think that it's more common in men or women, or what do you see in your practice?
It's actually about 10 times more common statistically in men than in women. And why that is, those numbers are starting to kind of come a little bit closer together, and I think because of the female population now engaging in the same activities men do, as far as in the workplace, the same stresses, and looking to relieve those stresses with some things that are attributed to the development of head and neck cancer.
Right. And so what would be the number one thing that you see as a risk factor or cause of the head and neck cancers?
Probably statistically, and what I see in my practice is probably consistent, is about 85 to 90% of all my patients diagnosed with throat-related malignancies utilize tobacco.
Okay. And some people might be shocked to hear that because they would think more lung cancer with tobacco. So it's very important for people to know that there can be some throat cancers involved with smoking as well, or tobacco use. People hear tobacco and they may just think, okay, this is just cigarettes. But does that include some other forms of tobacco as well that you see with? Basically
all forms of tobacco. Okay. Obviously, smoking tobacco is more frequently used, that form, in the United States or throughout the world, but chewing tobacco is a big risk factor in head and neck related cancers. Some of them are even more aggressive than the actual smoking related tobaccos.
And unfortunately, we're seeing an increase in the use of the chewing tobacco and things like that as well. So what are some of the other risk factors that someone might have for head and neck cancers aside from just smoking or tobacco? Basically,
smoking obviously is the number one. Alcohol consumption is a big factor. Basically, any kind of agent that it potentially can be considered a carcinogen that's constantly irritating the lining of the mouth and the throat can be associated with the development of a head and neck cancer. We see it attributed to reflux. So reflux, and people may know that esophagitis or gastritis, and that can possibly be related to the malignancies in those regions of the body. We also see it people who are from other cultures engage in certain dietary habits that are also attributed, such as the Indian population use a diet called betel nut that they chew, kind of like an aftermint or something like that. That unfortunately is a carcinogen. And nowadays we're seeing an increased rise in cancers related to the human papillomavirus, HPV, which people are aware of in relationship to sexually transmitted diseases.
Right. That's we talked a little bit about that earlier, just you and I, but that is something that needs to be more of a public awareness that it's not just sexually transmitted through intercourse and things like that. There is other ways to develop HPV in the oral cavities. So. All right. So what are some of the symptoms? Some people may be out there wondering, well, how am I going to know, what's some signs that I can look for to know that I need to see a doctor?
One most common symptom that we see that comes to our practice is someone who has chronic hoarseness that lasts for over 6 weeks, that has been treated by their primary care physician and continues to persist. Problems with swallowing. So if they feel like food is being hung in the back there and it's just not clearing, and they're choking on their foods more frequently with different types of consistencies. Pain related to swallowing. Also, for people who wear dentures, if all of a sudden they have a poor fitting denture and it just doesn't fit right, there may be an underlying sore related to preventing that denture from fitting. Or loose teeth, sometimes can be associated. Inability to open up the jaw very well, or a knot in their neck that they feel that just doesn't seem to go away. They've been on a couple rounds of antibiotics, doesn't necessarily cause them pain, so they're not as alarmed about it, but it doesn't seem to go away, and it may slowly, progressively get bigger. Those are some of the more common risks or common findings that we see.
Okay. Well, that kind of gives people some ideas on what they should, maybe worry about and maybe talk to their physician about. Let's talk to Vernell for just a few minutes, and let's hear a little bit about your story. We've heard, obviously, some of the symptoms and risk factors, but let's talk about your story and what you actually experienced and how you ended up at Dr. Kess's office.
I'd had a sore throat for almost a year, and I finally mentioned it to my internist, who got me an appointment with Dr. Kess.
Okay. And so whenever she came into your office, what were her symptoms aside from just a sore throat? Was that it?
Well, mainly, Vernell had a sore throat, and it just wasn't going away. I think that people who engage in tobacco use know in their head that they're concerned that possibly can be related to a malignancy.
Right.
So I see that most people who come to my office with a sore throat or hoarseness, they automatically come in scared that they may have a malignancy because they know they engage in an activity that can be related to developing cancer. So with Vernell, she had that chronic sore throat, and so that initiated the consultation with me, and then we started the workup.
Okay. And so, Vernell, what was your kind of reaction when Dr. Kess did all that and came back and said that it was cancer?
Shock.
Shock, I bet.
I mean, even though you are doing something to cause it,
right,
it's still shock.
Oh, definitely. Did Dr. Kess put you at ease about it and explain what the procedure would be?
Absolutely. He explained the procedure, which I knew nothing about.
Yeah.
I didn't even know how to ask him questions about it. But I did trust him.
That's important to be able to trust your
Absolutely.
physician.
Immediately I did.
Good. Well, Dr. Kess, tell us a little bit about the procedure that you actually performed on Vernell to remove the cancer.
Well, Vernell, first of all, we had to make a diagnosis. So what involves in a diagnosis is obviously, first of all, when we determine the type of treatment we provide, we want to do a staging process. And basically staging has to do with the extent of the cancer. Once we determine the extent of the cancer, then we will try to work as a team with other local oncologists and radiation oncologists to determine the best mode of treatment.
Right.
And so with Vernell, after we were able to do a comprehensive cancer workup on her and determine that she had a cancer, the location of the cancer, and the extent of the cancer, we felt that Vernell would be an excellent candidate for a new technology that's now available here in Western Kentucky at Western Baptist Hospital called the Vinci Robotic Assisted Throat Surgery.
When you heard that a robot might be doing part of your procedure, what did you think about that?
I thought, well, because of the way he felt about it,
You felt positive about it?
it sounded awfully good to me.
Yeah. And so what's the difference between actually having the Da Vinci robot to help you perform this procedure than the old way of just going in with?
Well, a lot, actually. Basically, the outcome is big. I think from an oncological standpoint, it has shown in the short time period that it's been in use to have as good an oncological control of treating the cancer than our previous techniques. But it also, as far as the recovery process, in preserving the voice in Vernell's situation, and as well as preserving the ability to swallow and getting much back into normal function. In the previous treatments, from a surgical standpoint, would have involved large incisions, possibly permanent disability of requiring a feeding tube, most likely, even removing the voice box itself and having a permanent opening here and utilizing an artificial form or an alternative form of vocalizing and communicating, which can be pretty devastating for a person.
Definitely. So Vernell, how was your recovery from that procedure that Dr. Kess performed?
I don't remember having any pain after. I probably did in ICU, but I don't remember any pain from the throat. Of course, it will take a lot out of you
Yeah,
to have that kind of surgery. And I came out of surgery talking,
that's good.
and I didn't swallow for a couple of months, but now I do.
Yeah. So how did you get nutrients and things like that?
I had a feeding tube for 2 months,
2 months.
and I had therapy at home,
Okay.
and then I quit the feedings and started eating.
Well, good.
Every individual is different, so obviously the age of diagnosis, other comorbidities such as their other physical conditions, a lot of times have to do with the rate at recovery.
Right.
So with Vernell, she did actually, for her age, did very well, but we had to take a little bit more time with her in progressing her to swallowing. Mainly what we did is we just kind of diverted that area till it healed up better, till she strengthened the muscles to swallow, and before we could allow her to swallow, because it puts her at a greater risk of that food or liquids going down the wrong tube, which can lead to problems in and of itself.
Right. Okay. So today, do you feel like you've had throat cancer, or do you feel like you're
Well, it really, at this age, it takes a lot out of you.
Yeah.
I'm not as strong as I was, but there's no pain. I've kind of forgotten about the throat surgery.
Who's mowing your lawn now?
I am.
All
Thank
right.
goodness.
Well, that's really good then.
Yes, and I'm doing everything for myself.
And how long ago was your surgery?
6 months, September.
Wow, that's really impressive then.
Yes.
So you've only been off a feeding tube for about 4 months then.
Right.
Well,
No
did you get off
problem.
of it in time for Christmas?
Yes.
Oh, that's a good
Yes.
Christmas present. Got to enjoy your
Yes.
Christmas food then.
Well, at least I had started eating.
Yeah.
I had to eat for about a month before I got the tube out. So I think that was after Christmas when the tube came out,
Yeah.
but I was eating.
Well,
We just
good.
had to make sure she was getting the proper calories by the
Yeah.
mouth before we could
Right.
get rid of the
remove it.
tube completely. Yeah.
That's a wonderful story that you do have, and I know that you're very proud of what Dr. Kess was able to do for you.
Oh, absolutely.
So a lot of times a person may come in though with especially like a throat cancer. How early was her cancer that you did find?
Fortunately for her, she had discomfort. And believe it or not, the location in which her cancer resided, it was just right above the voice box. We call that the supraglottic larynx. Most of the time, people do not complain of any symptoms until it has gotten to an advanced stage. For some particular reason, fortunately for Vernell, she had developed symptoms at an earlier stage that got her in. Even though she was having some throat-related symptoms for about a year, I'm still a little bit unsure whether the actual cancer caused those throat symptoms as opposed to some of the tobacco-related. And now Vernell quit tobacco, so she's eliminated a risk factors, which reduces her likelihood of a recurrence of this cancer. But fortunately for her, she had a symptom that we were able to find at an earlier stage, which gave her more options and a better outcome.
Definitely. Vernell, whenever you did smoke, about how many cigarettes did you smoke a day?
About a half pack a day.
Okay. And then whenever you were diagnosed, were you able just to completely stop, or did you have to have some assistance with that?
Well, while I was in the hospital, that I used the patches.
Okay.
But when you're in the hospital, it's easier to quit.
Yeah. And so after that, you didn't go back to smoking?
I just didn't go back, right.
Well, good. So now you've been smoke-free for 6 months too, right?
September 16th.
All right. Well, that's
It's kind of
great.
like a birthday. People remember that date that they quit.
It
Yeah,
is.
it's a wonderful thing.
It is. Well, let's talk a little bit about maybe some other people that may come in. They're diagnosed with throat cancer or another head and neck cancer. And for Vernell, she was lucky just to be able to have the Da Vinci procedure done. But what are some other treatments that a person may experience?
Basically, surgery has evolved a lot, and in head and neck cancer, because we're now kind of guiding ourselves towards minimally invasive, and that's where the Da Vinci robot fits in. The other regimens haven't really evolved that much, but we utilize also radiation therapy and also chemotherapy. Chemotherapy is something that we use to basically what we call chemosensitize the cancer cells to make them more receptive to the radiation. But basically, the main treatment is either surgery or radiation or a combination of the three.
Okay. And are there any side effects that a person may have from either the radiation or a more intensive surgery than what Vernell had?
Most definitely. I mean, obviously, when we're dealing with the throat structures, we can affect the ability to swallow. We can permanently alter the voice. We can affect the patient's ability to taste. So quality of life is very large, in those areas, because people don't really realize how much I think we most do, but when you lose the sense of taste, when you lose the ability to swallow, it's pretty significant, and it really affects the quality of life. So if we can preserve those structures and continue to allow them to function at their most, the highest level, I think people really are going to appreciate that. But unfortunately, depending on the stage at which the cancer is diagnosed, most likely one of those or all of them are going to be altered in some capacity.
Right. And so Vernell, for you, after your surgery, you had, I guess, a little bit of therapy at home, you said, for swallowing.
Yes.
And what exactly did they do to help you learn to swallow again?
Well, there was about 10 different procedures I did, and one was the most extensive, was sitting in a chair pushing myself up and either coughing or swallowing. I did that 30 times a day.
Okay.
Blowing up balloons.
Wow.
A lot of little simple things.
But it was a lot for you after that procedure.
It was.
Well, that's pretty good.
But it worked.
2 months.
It worked.
It just brings basically speech therapists that we employ quite frequently with these type of treatments, and it just brings recognition to that area and gives them a little bit of it's a physical therapy of the throat, basically what it entails, and we pretty much employ them in most of the patients we manage in this manner.
Are there any other types of therapy afterwards, for follow-up that somebody may have besides just speech or?
Physical therapy, because sometimes when we employ surgery in the neck structures, there's nerves in the neck structures that may be injured that can affect the shoulder, can affect different areas that would benefit from physical therapy to strengthen some of those alternative muscles that we need to employ to compensate for the disability of that one structure that's not working anymore.
Okay. Well, I think we've definitely learned a lot today about the head and neck cancers, and we're unique for Paducah because we do have some physicians that are very kind with their time and allow for some free screenings in Paducah. And so, Dr. Kess, you do that each year.
Yes.
And so let's take a few minutes and talk about this screening and what it actually entails.
Okay, well, there's a head and neck cancer screening that occurs annually. It actually was developed by the famous actor Yul Brynner. Yul Brynner died of head and neck cancer.
Okay.
And so it's kind of an anniversary. It used to be called the Yul Brynner Oral Cancer Screening. And most head and neck cancer centers throughout the university utilize that date around usually early spring to provide that service. And head and neck screening, we really try to bring people in who may have some chronic symptoms such as Vernell, as throat pain or hoarseness or a sore in their mouth that hasn't gone away, to give them an opportunity to have someone look at it if they're a little apprehensive about going to their doctor or scared of the fact that it could be something concerning. We also, during those screening, provide them with literature and information about smoking cessation and eliminating some of those risk factors that may contribute to why they're there.
Right. So if a person were to call and make an appointment for this screening and they walk in, what should they anticipate whenever they actually enter into the room? And you know, some people get nervous. You know, do they have to get in those gowns? You know, what exactly are they going to have to do?
No, basically they don't have to disrobe at all. They don't have to get into any gowns. Basically it's a screening, so it's not an intense exam.
Okay.
It probably, you know, we determine whether any further evaluation is required based on that screening. So basically we look in the ears, we look in the nose, we look in the throat area with just, you know, a head mirror, some flashlights, some, you know, tongue blades, and nasal speculums to look in the nose. We palpate the neck and feel the neck for the structures in the neck, and it's very brief. It probably takes no more than 5 minutes, 10 minutes at the most. We do a little bit of screening with some questions to ask them, and then if we feel it's necessary for them to have further workup, we will provide them with information to get into our clinic for an actual comprehensive exam.
Okay. And if somebody else is out there maybe and they're not going to the screening, would they have to be like Vernell and be referred to your office by a physician for?
Well, it all depends. No, you know, obviously this day and age with healthcare and insurances, depending on their insurance, the contract they have with their insurance, some of them will have to go to their primary care physician prior to being referred. Other people their insurance doesn't require them, and they can call and schedule an appointment with us directly.
Okay. So for these people that are coming to the screening then each year, about how many do you think that you used to follow up with? Have you seen in the past, percentage-wise?
Very few.
Okay.
Very few do we find anything. Most of the time we can put their mind at rest, and hopefully we can, you know, guide them in the direction of, you know, if they're doing anything that may put them at risk, help educate them and help prevent them from getting that. Because most people, like I said, if they have a symptom and they do engage in tobacco, the first thing they think about is that they have a cancer.
Right.
So, but we very few of those people, I would say probably less than 5% of patients we even ask to come back to see us for further evaluation.
Okay. But still, there's a few out there that have been, you know, obviously saved by one of these screenings.
Very much so, and you know, it's fortunate that we're not able to find something, or we put their mind at ease that their symptoms are not attributed to something worrisome like a cancer. But the ones that we do see, I think that all people should feel free to come in that may have symptoms or partake in risk factors that attribute themselves to or possibly can develop throat cancer. But you know, fortunately for most people, we're not finding anything that is too concerning, or fortunately we even are finding them at an earlier stage, and it can be easily treated.
Definitely want to find them earlier.
Much easier remedies.
Yeah. Well, Vernell, what would you say to somebody watching the show today, and what advice would you want them to know from obviously a survivor of throat cancer?
Well, my best advice is to see your doctor when it first starts, and I should have.
Yeah.
And I went to the doctor regularly, but it was not hurting enough to mention it to him.
So always tell him your symptoms, 'cause
Right.
you never know, right?
Absolutely.
That's great. That's probably the best advice you can give somebody, is to talk to their doctor about symptoms, because people obviously sometimes just have these
Even
symptoms.
if it's nothing, that's
Yeah.
good.
That's good advice. And what about you, Dr. Kess? What would you want the people that are viewing the show today to take away from today's show?
Well, I hope they learn in the brief talk that we had that, if they can, this is a cancer that if you listen to the statistics, that 85 to 90% of the patients who we diagnose with this cancer engage in something that, if they could eliminate that risk factor, tobacco use, we could nearly eliminate this cancer. So that would be, if there are a lot of different methods in which we can help educate people and get people to quit smoking and quit utilizing those tobacco use. So that's what I would like them to try to challenge themselves, to find the will and the strength to seek help in getting rid of that nasty old habit.
Yeah, good challenge. Good challenge. Well, thank you for watching today's show, and thank you for joining me today on the show and sharing your story and sharing your wealth of knowledge that you have as a physician. And we hope that you did learn something today. And if you need help with tobacco cessation, or for more information about today's show, call our office at 442-1310. We hope that you enjoyed today's show, and we hope that you join us next time.